Hi everyone, today we are going to discuss about short stature and the application of growth hormone for treatment of short stature. We know that children have only three growths. First is height, second is brain, and third is sexual maturity. And we have three hormones for each of this. For height, you require growth hormone. For brain, you require your thyroid that is produced from T4 that is produced from the thyroid gland. And for sexual development, you require testosterone in a male and estrogen in a female. Thyroid, we know, is always over tested nowadays. Any newborn baby born throughout the world is being tested for congenital hypothyroidism. So almost cretinism or congenital hypothyroidism is never missed nowadays because it's a universal screening advised by WHO. What about sexual development? Parents are aware nowadays about the sexual growth. Suppose a girl child doesn't have a breast or menses by 12 or 13 years. The mother takes the daughter to an endocrinologist or even a gynecologist and asks for the assessment of the sex hormone level. The same occurs in a guy with a small penile length or decreased testicle volume. So I told you children have three development. Height, you require growth hormone. For brain, you require thyroid. And sexual development, testosterone in a male and estrogen in a female. But what about height? Height, there is a hormone known as growth hormone. Why growth hormone is always left apart or many people don't go for short stature treatment? Because previously our concept in the brain of the parents, grandparents or even some doctors was that any child who is short at the age of 5 or 6 years, they ask the child to come back at 15 years and they tell that don't worry, whenever a child is short, they ask them to feed well, give enough amount of milk, ask him to play well, ask him to go for basketball class, ask him to take enough amount of fruits and vegetables and bring him back to me at the age of 15 or 16 years, he'll be tall as an adult. This was the reply of all the GPs or all the doctors who used to treat children with short stature. Because we used to think in our childhood that any child who is short will become tall as an adult. That nowadays occurs in only 50% of children. 50% of children who are short will ultimately gain a good height when they become adult because that is known as a late bloomer. But remaining 50% doesn't gain a good height even at the age of 13 or 14 years. Then they come with the parents to us at the age of 14, 15 years telling the doctor, I'm short, my brother, sister, everyone is growing apart from me, or when I go to the school, I am standing always in the first row whereas other children are increasing in height, or when I go to play basketball or other things, I am left apart because I am not gaining height. So this child was brought to a pediatrician or a GP at the age of 5 years. The mother and the father tell that my child is not gaining height, but ultimately he was reassured that he will gain height at the age of 14 or 15. Ultimately at the age of 15, the parents are again coming back, the child is remaining short. This occurs often and that is why growth hormone should be addressed in childhood. Suppose you think that your child is not growing at par with other children of the age group, or you are going to the assembly, your child is always standing in the first row whereas other children are growing back, or your elder child is not growing at par with other children of the same age group, you think that something is abnormal in your child. So go to an endocrinologist, ask the doctor, doctor, my child is only 5 years or 10 years. He or she is not growing at par with other children. So will he gain adequate height by 15 or 16 years, or do we need to start treatment with growth hormone? Suppose an endocrinologist examines the child, has a physical examination, checks your height and mid-penile height, check the growth hormone IGF-1 level. In a female, they may check for a karyotype, calcium, vitamin D, iron status, and many times an X-ray left hand for bone age. So leave everything. You are taking to an endocrinologist. Endocrinologist does the blood test and other physical examination and an X-ray and tell you that don't worry, this is just a physiological short stature. The child will gain adequate height by 14 or 15. Don't worry, go back, but keep on checking the height velocity every 6 monthly. And if the height velocity is poor, again go to an endocrinologist so that he can start treatment with growth hormone. Remaining 50%, but the endocrinologist examines and tells with the growth hormone or karyotype and X-ray left hand for bone age and tell, no, this is a pathological short stature. You have to start growth hormone now itself so that the child gains an adequate height. Then don't wait, start growth hormone immediately. What happens? We diagnose many of the children with short stature with growth hormone deficiency 8 or 9 years, but the parents tell that, oh doctor, we will come back after 2 days or 3 days to start growth hormone. They never turn back. They go and take all the supplements, all the YouTube medicines, all the so-called alternative medicines, go and play gymnasium, basketball, everything. Then they bring back the son or daughter at the age of 14, 15 telling that, no doctor, we came to you 5 years back for growth hormone. That time we didn't have time, doctor. Now we'll start growth hormone. By that time, the children comes at 14, 15, the bone is already fused. You take growth hormone, there is no benefit. That's why I told you, growth hormone is effective for a child for growth during the growing page. 90% of the bone fuses by the bone age of 14 years in a female and 16 years in a male. I told you there is three hormone. Height, you have growth hormone. Brain, you have thyroid. Sex, you have testosterone in a male and estrogen in a female. Thyroid can be taken right from the day of the birth to the death of a person, 100-120 years. Testosterone in a male can be taken from 13 years to 65 years. Estrogen in a female can be taken from 12 years to 60 years, but growth hormone can be given during the period of growth only. So your child is short at the age of 5 years and the bone is going to fuse by 12 or 14 years. You are waiting till 14 years and coming to the doctor and at the age of 14 years and then doctor, let us start growth hormone. There is no effectiveness at all. So always think that start growth hormone treatment, diagnose growth hormone deficiency early and start growth hormone treatment. So suppose you are going to the doctor, and how do you predict that how much height that a child will gain compared to the parent's height? So that is known as a mid-parental height. Suppose my daughter is 8 years, you are having a son of 5 years. So how much height that she or he will gain at the time of adulthood is calculated by the formula of mid-parental height. So what is mid-parental height? It is always father's height in centimeter plus mother's height in centimeter divided by 2 plus 6 point for a male child minus 6 point for a female child. So basically understand, suppose you are having a child with short stature, you know that how much height that he or she will gain at the time of adulthood is decided by the mid-parental height. So you are calculating the mid-parental height. Your father is 150 centimeter, mother is 150. So it is father's height of 150 centimeter plus mother's height of 150 divided by 2. Plus 6.5 is the average mid-parental target height of a male child minus 6.5 is the average target height of a female child. That is father's height in centimeter plus mother's height in centimeter divided by 2 plus 6.5 for a male child minus 6 point for a female child. This is the height that the child will gain at the time of adulthood. So this is known as a growth chart. So whenever a child is short, you go to an endocrinologist, they will plot in the growth chart. They will check the height and the mid-parental height. If the child is not growing at par with the parent's height, the child's height is there but the parent's height is much more and the child is not growing at par with the parent's height, they will immediately ask to check the growth hormone, IGF or chromosome. So roughly understand, height is always important. Height, you have growth hormone. And why I give so much awareness about growth hormone therapy? Because we know that thyroid can be taken at any age, testosterone, estrogen at any age. But children come for short stature with their parents at 5 or 6 years. Many times 50% the parents discard that. Parents discourage that, don't worry, I was short during my childhood. I ate well, I became a tall at 15, 16. So this will same will happen to you. So 50% of the children are ridiculed that way itself. So that the parents will know, I'll treat you at 15 years, you eat well and go exercise and come back. 15 years, 50% gain height, 50% doesn't gain height. Remaining 50% are discarded by doctors. But the doctors say, don't worry, I have seen so many children during my whatever treatmentship. You don't worry, you eat well, you come back at 15. Everyone tells that you come back at 15, you will gain height. 50% of the children who are short will gain height by 15, remaining 50% doesn't grow. For them, they require growth hormone. There is no point in taking growth hormone, your bone fuses, and your bone fuses by the bone age of 14 years in a female and 16 years in a male. Among this, the maximum catastrophe occurs in a female child because a female gains maximum height after breast development and before menses. Previously, menstruation used to start by 14 or 15 years. Nowadays, girls start menses when they are studying in 3rd or 4th standard. So many of the girls have menstruation starting by 10 or 11 years. So by the time their menses starts, their bone fuses, and the maximum height that is gained in the life of a female child after the onset of menses is 4 centimeter. So later the menses, suppose a girl has a menstruation starting by 15 years, she will grow slowly till 15. That's a late puberty. Suppose a girl has menses starting by 9 or 9.5 or 10 years, she will stop growing by 10 years because invariably it is the bone that fuses when sexual maturity occurs. That is why it is known as a bone age now. The height never depends according to the calendar age. Your calendar age may be 10 years, so this is known as a bone age. Your height stops when your bone fuses. Once menses occurs, the bone fuses. Before menses occurs and the growing period, the bones are wide apart. This is the part where we take growth hormone. Once the bones are not fused, you take growth hormone and the child gains in height. But after 13 or 14 years, once the bone fuses, there is no point in taking growth hormone. So ultimately, everyone learned the point. For height, you have growth hormone. Whenever your child is not growing, go to an endocrinologist. Ask the child to be evaluated by the endocrinologist. Let him or her evaluate. Suppose the endocrinologist tells, don't worry, your growth hormone, karyotype, calcium, vitamin D, X-ray left hand, bone age is normal, don't worry. But still go to the doctor every year or 6 monthly and check the height velocity. Suppose endocrinologist tell that no, it's a growth hormone deficient condition or a Turner syndrome or a syndromic short stature where you are going to respond by only growth hormone. Don't wait, start growth hormone early because you are going to get the benefit by 13 or 14 years your bone is going to fuse. If your girl is going to have menses by 8 or 10 years, the bone is going to fuse by that time. So start growth hormone treatment early. Many times you ask me, what's the problem not taking growth hormone? Is growth hormone deficiency going to lead to a heart attack, kidney failure, liver disease? No, it is not going to lead to a heart attack, kidney failure, liver disease like your type 2 diabetes or obesity. But ultimately, growth hormone deficiency and short stature cause only one disease, that is known as an inferiority complex. Right from your childhood to puberty to adulthood to parenthood to grandparenthood, the stigma of having a short stature, called by everyone as a dwarf for a short stature, that stigma haunts you and your children like anything. So start treatment early with growth hormone. And how to take growth hormone? Growth hormone, that is GH, that is non-ectropin. So Novo Nordisk company which produces insulin, they have once daily growth hormone of non-ectropin. Pfizer, where we are taking vaccine, they also have once daily growth hormone of genotropin. So growth hormone was previously taken once in a day, just like insulin is a subcutaneous injection. Now we have once weekly growth hormone. So previously we used to take growth hormone every day in a month. Now it is once weekly growth hormone in a dose of 0.66 milligram per kilogram per week. So you need to take growth hormone once every Monday only. You calculate the dose. Suppose a 10 kilogram child, 0.66 milligram per kilogram per week. So 10 milligram, one shot injection every Monday. So monthly 4 injection, or yearly we need to take only that much, 54 injections in a year, whereas otherwise we used to take 365 injections, that's injection every day. So growth hormone treatment is always easy nowadays. It is only the early pickup of children with short stature. Pickup should be done by the children itself. If the children themselves tells the parents also they are short, the parents should at least know that 50% only my child is going to grow, remaining 50% is not going to grow, and the doctor also should not miss that. Doctor should not give false assurance that don't worry, exercise and come back at 15 you will gain it. That false reassurance also should not be there, because it's an irreparable loss. Because the child comes with short stature with bone fusion at 14, 15, you can't repair that. Then you have to go for Illicera method. You have to break the bone, bring in the rod and increase the length. That's an impossible method. It's very, very costly. So basically awareness of short stature and awareness of growth hormone therapy is very, very important. So short 50% is normal. They will gain height by 50. Remaining 50% have growth hormone deficiency or growth hormone insensitivity state. So go and evaluate and get started treatment early. Nowadays once weekly growth hormone, the only side effect of growth hormone is probably the cost. Growth hormone is a costly hormone, but it's worth the money, because you are having a height of 150, you need to get a height of 170, you are increasing height of 20 centimeter, your outlook of life changes. Your weight you can reduce at any age, 30, 40, 50, 70. You can take an injection or exercise or do a surgery and reduce your weight. What can you do with your height? 20 centimeter height changes your identity. It gives you confidence, and ultimately your growth hormone helps you before your bone fuses before 14 years in a female, that is bone age, and bone age of 16 years in a male. This is in short. So get awareness about growth hormone treatment with your children and grandchildren, whatever, and start treatment early and assure them a good height. Thank you.